Greetings, dear student of anatomy. Today we shall be looking at the osteology of the thoracic limb. In other words, we shall be studying the bones that make up the entire forelimb and forelimb girdle of our animals, of an animal. Okay, this is Fred Academy. Okay, the link below this link here would, if you can copy it out, you can and paste on the address bar of your browser, it can take you to the the, the main page of Dr. Fred Academy where you can find many of our videos. Okay, now let's get now. As you all know, you would have been informed, or you know that the thorax or the skeleton in general is made up of, or is divided into two. Okay, the axial skeleton is the axial skeleton, and then the appendicular skeleton. The axial skeleton is made up of the skull, the vertebral column. Okay, this is the vertebral column, the ribs. These are the ribs, left and the right part, and then the sternum. This is the sternum. Okay, and then the appendicular skeleton. The appendicular skeleton is made up of the attachment, those attachments, okay, to or those bones that are attached to the axial skeleton, okay, like the pink colored bones, pink colored ones, okay, are attachments to the central axial skeleton, okay, and they include the forelimb girdle, okay, and then the forelimb, and then the hind limb girdle, and then the hind limb. The forelimb girdles include the scapula, the clavicle, and the coracoid. Okay, while the hind limb girdle include the ilium, the ischium, and the pubis. Now this is a man, okay, and then this is a forelimb, and then this is a hind limb. Okay, so the function of the girdles here is to attach the limbs, the axial skeleton. Okay, so the the oscose or the pelvic girdle attaches or holds the hind limb to the axial skeleton, while the scapula, clavicle, okay, and the coracoid attaches the forelimb to the axial skeleton. Okay, now this is just to uh, use something that you're more familiar with, or that you should be familiar with, to uh, let you know about it. Let's look at the animal, okay, and let's look at that of the dog. Okay, now the just like I said earlier on that the skeleton is very in parts, the axial skeleton, okay, and then that is the yellowish ones, then the appendicular skeleton, which is a bluish bone, colored bones. Okay, now the axial skeleton is made up of the skull, the vertebral column, all right, this is the vertebral column, the ribs, and then the sternum down here, the sternum. No, the ribs are attached ventrally to the sternum, okay, while the ribs are attached the vertebra to the thoracic vertebrae dorsally, okay. So now the appendicular skeleton are those bones that are appendages, they are attachments to the the axial skeleton, okay. Now and then those appendicular skeletal structures include the forelimb girdle, forelimb, the hind limb girdle, okay, and then the hind limb. So, okay. Now this forelimb girdle include the scapula, the clavicle, and the coracoid, while the hind limb girdle include the ilium, the ischium, and the pubis. Now we'll come to that, but you know that the purpose of this study is just to talk about the forelimb, okay, and the forelimb girdle. Okay, so let's proceed. Now, the bones of the forelimb are classified or grouped as follows. This is the body parts, and then this is skeletal structures found there. Okay, the body part in the shoulder, the skeletal bone or the bone found there include or that the bones make up the shoulder include the clavicle and the coracoid, generally speaking. All right, while bones that form the arm or upper arm or brachium is the what? The humerus. So this is the humerus. This is scapula. Okay. We'll talk about the rest of the bones here. This is the clavicle and the coracoid. But this is scapula. Now the humerus, which forms the upper arm or the brachium or the arm, is here. Okay. This is a man. Just using this just to show you what we're talking about, using something or structure that you're more familiar with. Now, the next thing here is the bones of the that form the forearm. Okay, that's the next one. Bones that form the forearm on the antebrachium. They are the radius and the ulna. So we have the radius here, we have the ulna. So these two bones form the antebrachium or the forearm. Okay. Now coming down here, we have the manus. The manus is made up of the carpal bones, the metacarpal bones, and the digits. Okay. So which is equivalent to the wrist in man, okay, it's formed by the carpal bones. While those bones are formed the palm, inside the palm of the hands in man are the metacarpal bones, while the bones that form the fingers or the digits are called the phalangeal bones. That is, we have the proximal, the middle, and the distal phalanges. Okay, so now these are actually bones that we shall be studying or looking at in this exercise. Now, this is, of course, you know what we're studying is veterinary anatomy, and then these structures have variations. Okay, scapula, the humerus, the radius, the ulna, the carpal bones, metacarpal bones, and just, they all have variations. They have some slight differences in different animals. So those differences we shall also look at them. Okay. Now this is what we see in humans. Okay. This is what you see in humans. Okay. This is what we find in the dog. This is the that of the pig. Now this is what we find in the sheep or ruminants. Okay. And then this is what we find in the horse. Okay. So if you look down here, you'll see some variation. But we'll get to a point where we can show you clearer images that exists, okay, among these structures. So now, just like we looked at the different parts of these bones, we looked at the shoulder joint, we looked at the the upper arm, we looked at the forearm, we looked at the carpal, we looked at the metacarpal, and then the digital bones. So let's take them one after the other. So we shall be starting with the bones that form the shoulder joint. Now, the bones that form the shoulder joint include generally they include the scapula, the clavicle, and the coracoid. Three main bones. Okay, this is the link to the YouTube channel. You can just get this typed into your your browser, and then you directly to the other videos that you can watch to explain this the shoulder, the bones of the shoulder clearly. That's the scapula, the clavicle, and the coracoid. Okay. Um, Another way is okay. I can also drop this link okay on the comment section so that you can access these other videos by just clicking on the link. Thank you. Okay, so let's proceed. The shoulder joint, the shoulder bones of the shoulder region. Okay, we said they include the scapula, the clavicle, and the coracoid. Now, I must inform you that out of these three bones, the one that is most developed is the scapula. Okay, the scapula is the one that is most developed amongst the three of them. So this is the scapula. This is the scapula. Okay, these are various images, pictures of scapula. And now, in an animal, for example, the horse, this is where the scapula is. This is the position of the scapula in the horse. I see it. This is the position of the scapula in the horse, right? Okay. Now, the next thing we shall be looking at is the other bones, is the clavicle and the coracoid. So, like I said, scapula is the most developed and is the largest bone amongst the three of them in our domestic animals. Now, the clavicle usually is not developed fully in our domestic animals. The clavicle did not fully develop or did not even develop at all in animals, in the animal. The animal, okay? It is usually thought to be present in a place called the clavicular intersection in the brachiocephalicus muscle. Okay, in a place called the clavicular intersection in the brachiocephalicus muscle, and you find that as a fibrous connective tissue. Okay, but the case is different in the cat. Okay, this is an image of an image of the clavicle cat. So in the cat, clavicle exists as a slender bone or rodlet. Okay, I see it now. Now this rodlet is also found in that same muscle called the brachiocephalicus muscle. Okay, this is a radiograph of the brachiocephalus of the shoulder joint in the heart. Okay, so you see this slender bone now. It is the clavicle. Okay, present in the present in the heart. Okay, so it's a small rodlet or a small bone or slender bone present in the cat. So in the cat, you find actually a real bone found in that position in the clavicular intersection. I would come to a point where I will show you their position. Okay. Now, what bone here is so okay. Uh, uh, Let me take us back a bit. I already talked about. I said the scapula develops as a full bone and is the largest among the three. Okay, while the clavicle is present or is believed to be present as a fibrous tissue, not a bone now, in the domestic animals, but in the cat, the clavicle is present as a slender bone, okay, in that same um, position called the clavicular intersection. Okay. Now, what about the coracoid? The coracoid uh, did not also fully develop in a domestic animal. It is present as a vestige or as a remnant, okay, of the bone, okay, found on the medial surface of the scapula. Now, this is scapula, this is the lateral surface, this is the spine, but this is the medial surface. Okay, that is the surface behind, opposite to this surface now is the medial surface. Okay, so this is the medial surface. Okay, so on this medial surface on this medial surface, down here on the ventral part of the medial surface, you find small process or vestige of bone called the coracoid process. The coracoid process. Okay, so we you would notice that the coracoid and the clavicle did not fully develop in animals. Okay, but the only bone that developed fully in animals is the scapula. Is the scapula. Now I've shown you the position of scapula, how it sits in a living animal. Okay, it sits at an angle of about 45 degrees centigrade, 5 degrees, 45 degrees, sorry. Okay, this is an angle of about 45 degrees. Okay, now let let's proceed. Let's look at this fully. Let's look at the scapula fully. Now, generally, the scapula has um, three uh, three angles. There's an angle, there's an angle, there's an angle, and it has three borders. This is a border, this is another border, then this is another border, and it has two surfaces. This is the lateral surface, and the surface behind this is on this side now, okay, which is this. Okay, that's the surface that is in close opposition with the ribs, the medial surface. Okay, let's go back a bit. Okay, um, okay, no need of going back. Now, the the surfaces like the surfaces like I said include the lateral surface and the medial surface. So let's talk about the features of these surfaces. Okay, in the scapula. In the scapula. Now, on the lateral surface of the scapula, we have the lateral surface of the scapula is divided into or divided unequally into two parts by the spine of the scapula. This is the spine of the scapula. Okay, it's called the spine of the scapula. And then this spine divides the lateral surface into two. Number one, or the cranial surface, is called supraspinatus. Sorry, it's called the supraspinous fossa. Supraspinous fossa. While the caudal portion or part is called, that is the part that is behind the spine, is called the infraspinous fossa. Okay, so this is supraspinous fossa, this is infraspinous fossa. Okay, lying inside or lying within the supraspinous fossa is a supraspinatus muscle. Lying within the infraspinous fossa is the infraspinatus muscle. Okay, now if you look at this spine of the scapula, um, usually there is a little enlargement about the midpoint of the spine, even though it is not very prominent in that of the dog, but you see it prominent in other larger animals. Okay, now just in case you see them, that that enlargement almost at the center of the spine, around this point, is called the tuba spinae. That is the tuba of spine. Right now, down here in some species, uh, like the dog, okay, in this one, we have what we call acromion process. Okay, it is also an enlargement, okay, which allows for the or provides space for the attachment of the muscle called the deltoides. Okay, the deltoides muscle. While the tuber of spine here allows or furnishes the attachment of the muscle called trapezius. Now, that is that about the lateral surface of the scapula. Let's look at the medial surface of the scapula. Medial surface of the scapula has a central depression. This is a central depression. Okay, a little depression at the central point. This one here is called the subscapular fossa. Subscapular fossa. Okay, it allows for the attachment of the muscle called the subscapularis muscle. We also have on this area, on this point, the two edges, okay, the two dorsal angles. You have a triangular space, roughened triangular space. This one here, and then this one also here. These spaces are called the area serrata. Area serrata. Okay? And they are for the attachment of muscles called serratus ventralis muscles. Okay, serratus ventralis muscle. Okay. Now, um, let's talk about the angles of the scapula. Let's use this now. Angle of the scapula include the cranial angle. Is a cranial angle here? The caudal angle is here, and then we have the ventral angle. The ventral angle is also called the articular angle. Why is it called articular angle? Because it is the angle that is involved with the articulation with the humerus. That is why it is called the ventral angle or the articular angle. Okay, now let's look at the borders. This one here is called dorsal border. Okay, of course, facing upward is the dorsal border. Okay, you cannot call it a vertebral border because it is in close apposition with the thoracic vertebrae. So it is called the what? The thoracic border or the dorsal border. Now this border here is called cranial border, while this border here is called the caudal border. You see that the cranial border is a bit convex, while the cranial border is a bit straight, and coming ventrally becomes a bit concave, a bit of concave in shape. All right. Now, having talked about the surfaces, the borders, and the angles, okay, and the angles. Let's move on. Okay, let me also say something about this medial surface. Okay, on the medial surface, we say we have a central depression or shallow depression, which is called the subscapular fossa, and is meant for the attachment of the subscapularis muscle. We also have two triangular spaces, that is the area serratus, meant for the attachment of the serratus ventralis muscle. Now, coming down here towards the ventral angle or the articular angle, there is an attachment, this little process, which is attached to the supraglenoid tubercle. Okay, you know, this is the glenoid cavity, the opening here, that's a cup-shaped cavity, okay, which allows for the attachment of the head of the humerus. Okay, now a cranial cavity is an enlargement. It's called the supraglenoid cavity. So on the medial side or aspect of the supraglenoid tubercle, you find that little process or vestige, which is called the coracoid process, still on the medial surface of the scapula. And on this coracoid process is attached the muscle called coracobrachialis, the coracobrachialis muscle. Okay. Remember that the enlarged structure here is called supraglenoid tubercle. What is the glenoid cavity? Okay, cup-shaped cavity, which allows for attachment or for the lodgement of the head of the humerus. So on the medial surface or medial aspect of the supraglenoid tubercle is attached that vestige of bone, which is the coracoid process, allows for the attachment of the coracobrachialis muscle. Okay. Now, uh, on the dorsal or vertebral border of the scapula is attached a cartilage. This is a cartilage, and this cartilage is called the suprascapular cartilage. It furnishes uh, the attachment or creates space for the attachment or enables the attachment of the rhomboideus muscle. The rhomboideus muscle. Okay. Let me let's proceed. Let's talk about so this. I think it is clear. The scapula is clear. You have a better understanding now of the scapula. Let's look at a little bit more of the clavicle. Now, the clavicular intersection in horses is a remnant of the clavicle, existing as a transverse fibrous tendinous band. Fibrous is a transverse fibrous tendinous band. Okay, transverse fibrous tendinous band within the brachiocephalic muscle. This is the brachiocephalic muscle. Okay, of course, it is a muscle that's made up of two or three parts. Okay, but primarily two parts. That is the brachialis and then the cephalicus. The cephalicus which divides into two: cladomastoidus and then cervicalis, depending on the species. This is the dog. So this is the cervicalis and the mastoidus. Now this is the clavicular intersection, and this is where uh, the clavicle is embedded. But in most species, they exist as a transverse fibrous tendinous band. Okay, except in the cats where it exists as a real slender bone. Clavicular intersection in dogs and cats is a tendinous intersection within brachiocephalicus muscle that acts as a vestigial collarbone. Cats possess a small floating bone at this site, whereas dogs have a fibrous non-bony remnant, both facilitating movement and allowing for a wide range of motion. Now, this is clear about the clavicle. Below here we have a comparison table, okay, which allows you to compare between the cat and the dog, okay, between the Felidae and the Canidae, and some of the features of the clavicle. The clavicle in the cat is a small bone, usually ossified, while in the cat it is a fibrous intersection or rudiment. It is fibrous in nature, it's not bony. Okay. Now it is easily palpable or distinct in cat, while in dog it is inconspicuous. Okay, it just exists as a fibrous line, as you can see here. Fibrous line. Now, what's the function? It is for flexibility, digging and jumping in cats, while in dog it increases shoulder motility. Okay, the average size in cat is 5 cm, while in dog is about 1 cm. Okay, all right. Let this is a further description of just to show you the different portions or parts of the scapula. Okay, this is a lateral surface. This is the medial surface, and these are the different parts and names. Um, this is in the bovine species. Okay, in the bovine, as you can see, the little enlargement here, that's a tuber of spine. Okay, and then the acromion process, which allows for the attachment of the this muscle. This is the medial surface, and then there's a cranial view of the scapula in the bovine species. Now let's see that of the rabbit. Now, from what we have here, apart from the acromion processes, okay, there is an additional lateral, okay, additional lateral and caudal projection, okay, of the spine of the scapula. And these additional projection of processes are called suprahamate process. Okay, it is important for locomotor adaptation, especially for fast running and forelimb ability. See how enlarged the spine is here in the cat. All right. So these additional projections is very, very spectacular. Okay, it's something to take note of in these two species. Okay, you have them in the rabbit, and then in the cat. Yes, you have them in the rabbit and in the cat. Okay, let's look at the horse and see that of the horse. So in the horse, there is no acromion process. In the pig, there is no acromion process. Okay, you still have a little enlargement. That is the tuber spine in the horse, while in the pig, it is tuber spine very, very much, much, much more enlarged. Okay, Now the parts are actually the same. Now this is a video, okay? This is a video that you can watch, okay? The video explaining further the spine, sorry, the scapula itself, okay? This is the scapula of bovine species, okay? So you can watch this video and have more understanding on this. You can watch it on YouTube. And um, you just type in scapula or the bovine scapula, bovine scapula, full stop, Dr. Fred Academy, the bovine scapula, full stop, then Dr. Fred Academy, and you get this video. Okay.
Good day, my audience. You are welcome to this channel, Dr. Fred Academy. Um, Today, in this video, we shall be looking at the scapula. We shall be discussing the scapula.
Okay.
Normally, we all know that the pectoral girdle of the domestic animal is made up of three bones. These three bones include the scapula.
This is also another video explaining the shoulder joints, okay, and then the humerus, okay, showing you the point of union between the scapula humerus. That is a scapulohumeral. You can just go to channel Dr. Fred Academy and then search for equine humerus, equine humerus, and you get it there.
Good day, my audience.
Okay. Um, having done that, uh, I can say that we are done with the bones of the of the shoulder girdle. Okay, that's the bones of the pectoral girdle. Okay, so in our next video, we shall be looking at the bones arm or upper arm. Okay, so I look forward to this video. Thank you.